third RFP or LOI session for the Paso del Norte Health Foundation's Recovery, Preparedness, and Transformation Grant Process. I'm Michael Kelly, the Vice President of Programs at the Foundation. As a reminder, today's session is recorded, and next week it will be available on the Health Foundation's website underneath the Grant Center. If you have any questions today, please enter them live in the chat box. Jana Renner, a program officer for us, will be monitoring the chat box and get those questions to us. The first session we had was on recovery. You can see that session recorded, which essentially means how do I get back to office? How do I get back to operational? The second session was dominantly on preparedness. What do I do in case of another crisis, not just a surge in COVID-19, but there are other types of disasters or crises that can and do happen. How do we better prepare? We'll cover some of that ground today as well, but today is dominantly about transformation. And by that, we mean transformation of a service line or sector or kind of population you may be working with. Transformation of your organization itself, which would include perhaps partnerships or limiting or expanding services, or transformation of a system, how a variety of nonprofits, government, and private entities work together more effectively for the future. With us today, starting off, is the Reverend Bill Schlesinger from Project Vita. He has been there for a very long time. And Project Vita is a federally qualified health center located down by the Bridge of Americas in El Paso, Texas. And today I'm going to be asking him some questions about his multiple nonprofits, his strategic partnerships, and how he has been preparing for a potential crisis, and how he is thinking about transformation, has thought in the past and in the future. Welcome to our session, Bill. Go ahead and take yourself off mute if you would.
Okay, I'm here.
Thank you. So let's dive right in with Bill, and then we're going to get into a local CPA after that, who will chat with us some about preparedness and transformation, and then we have our Realize panel after that. So Bill, let me just start off with asking, how is Project Vita thinking about preparing for a potential new surge in COVID-19 or other crisis? You can give some specific examples, or just tell us how you think about these changes.
So I guess it starts with an assumption that life is pure change, and that there is nothing that's going to be the way it is going forward, and that it is it's kind of like walking. If you don't move your other leg, you're going to fall down. So we've got a perspective that what we're about is how does community be intentional and sustain itself and move forward. And that puts us into the context of a wide web of systems. So it's not just about being an agency any more than it's about being an isolated individual. It's about being part of what's going on around us. When change happens, it happens in lots of different ways and affects us in unexpected discoveries. So in terms of this particular situation, we had already been looking at how we do care for people in a variety of venues that are hard to get to, and for people that are hard to bring in. So we've begun some telemedicine work. We've been involved in investing in school campus-based behavioral health, but we've also been doing housing programs and trying to figure out how to deal with changes in how those are being funded. So one of the things that I think happens, or I've seen happen, is that people can get stuck. They can think that what they've been doing is what they must do, and they hang on to a position instead of a value. We've got values, values that deal with how do people take responsibility for their own lives, and how do you make it possible for that to be easier rather than harder. How do you be more inclusive? How do you figure out when people are being left out and find a way to bring them in, to respect their diversity and their gifts? And then you run into contradictions. And that's where it's really helpful to have people, and I've got some very special people in my life that can figure out what will go wrong. And you listen to them. And you then try to figure out how to deal with what might go wrong before it kills you. So you take your contradictions very seriously, and then you figure out a way around them. So typically what we've run into is folks that say, well, we can't do this because there's too much risk. So we've then come back and said, okay, how do you quantify risk and buy insurance to cover it? How do you deal with the risk fear, but without letting it stop you? We've done a lot of distributed responsibility in our organization. So we've got very strong leadership in different program areas who don't make decisions in a vacuum either. It's not that you give somebody autonomy to run off and do things, but you give them responsibility to come up with proposals that then get vetted by the rest of the leadership team. So there's constant communication back and forth, and when there isn't, we pay for it, with how this new project, we just started testing, for example. Well, testing is being done on our site in a drive-through that's inside our garage. Well, that garage was also being used for food deliveries for our homeless population that our teams were taking food out to when they'd been rehoused. So they didn't talk to each other enough. So we had a little bit of a glitch on where do we unpack the truck from the food bank and keep these vehicles moving through and getting people tested. So you kind of keep adjusting and you keep figuring it out, and you try to get people focused on not blame, but fix. So you bring problems forward, you identify them, and then you try to fix them, even with your auditors.
Thank you so much. Hey, Bill, so tell me, I'm sure with your years of experience, you've seen some programs come and go. And you might have even returned to a program you had years ago and you're bringing it back. Do you have any thoughts about how and why a nonprofit may stop a particular program or line of service or return to something very fundamental that may be decades old?
So programs are a function of need and capacity. When needs change, you change your programs. We've had programs that were targeting moms of newborn kids who didn't know how to read a thermometer. And so we were getting a lot of referrals from what was then Thomason, now UMC, of moms that were bringing their kids in for non-emergent causes. And they were just using the emergency room for a kid had a fever that spiked at 100. It wasn't that serious, but mom didn't know what to do, took the kid to the emergency room. So we began to do an outreach program that addressed that. Then UMC got kind of smart and built that into their own community clinics. They didn't need us to do that anymore. So we stopped that program. But we took the people who had done that and we began to do other kinds of outreach and health education. And health education has become a big business for us now and is a major part of our program. We just got a new grant to open up in the Conotillo district. We would go back to that if we found that that was a need again. We've got the capacity to do it. In other places, we had unique capacities. We had artists who were working with us, and we were able to do really creative work with some kids doing artwork. When we lost that particular artist, we had to shift and find somebody else. So it's a combination of need and capacity.
Thank you for that. So remember, Jana is watching the chat box, and if any of you have any questions for Bill, I encourage you to ask them now. But my next question, Bill, is going to be on strategic partnerships. From looking at Project Vita, I have seen that you just mentioned Canutillo, but you have strategic partnerships with other nonprofits, with government entities, with for-profits. And, sometimes strategic partnerships can be threatening, maybe to the smaller partner, to an executive director. Boards need to be brought along. How do you know when it's the right time to, just partner, to really collaborate, or go all in and share governance on something? Tell me a little bit about your thoughts there, if you would.
Well, I'm looking at several of our partners. So we've got one of the questions that we've always raised is, who else wants to make this thing happen? Those are your partners. And the folk that are willing to work with you, you take it step by step. You try to work out what the issues might be. You identify the contradictions. What are the challenges? What will we have to do to make it work? Can we live with doing that or not? And then it's like any other relationship. You trust, you verify, and if things blow up in your face, then you deal with it. And sometimes that means walking away. But you try to resolve it first. And you talk before you act. You ask what's going on. You see if there's a way to deal with it or not. But we are a network of relationships. Strength is not in autonomy. It's in how those relationships can be built and sustained and made human.
Great. Well, thank you. I don't have a whole lot more questions before we move on to our auditor, but Bill, do you have anything to kind of leave our group with, particularly related to thoughts around preparing for a future crisis of any kind, whether that's a financial preparedness or governance preparedness, physical preparedness, or anything around transformation of Project Vita and thought there?
Hang loose, because it's going to happen.
Great. Well, thank you for being here, Bill. He's going to be with us for a while longer. If anybody has any questions, make sure to type them in the chat box. Our next guest today is Teo Cabrera. And Teo is a certified public accountant and a graduate of the University of Texas, El Paso, holding a master's degree in financial accounting as well as his bachelor's in accounting. He has years of experience and has been with the same firm since he graduated from UTEP. He does audit engagement with government entities, nonprofits, HUD-insured projects, reviews financial statements, and does due diligence procedures. He's a graduate of El Paso Leadership El Paso's class 38, and he's also was the president of the board of directors of the El Paso chapter of the Texas CPA Society during 2019, and a recipient of the Rising Star Award issued by the CPA Society in 2018. And we're very happy to have him with us today, because I think Teo sees some of the background behind the nonprofits and can see some of their strengths and weaknesses. So Teo, if you'd take yourself off mute, and welcome everyone. I'll start with the first questions.
Sure. Thank you very much, Michael. That's a very nice introduction. I appreciate it. I really appreciate being here. I see some familiar faces over the years. I've worked with many of you, and I'm happy to bring any insight that I can to this group. I have worked with several nonprofits, particularly those in the healthcare sort of niche, and also those that are more in the housing and homeless prevention niche. So I'm hoping that I can bring some good ideas to you today.
Great. Thank you for giving us some good ideas on protecting our balance sheet from a crisis, preparing us and helping us transform, particularly around the finances, due diligence areas. So let's start in the preparedness area. And what are some recent considerations that have been brought up by nonprofit organizations that you've heard?
Okay, well, of course, one of the main considerations that I'm seeing right now is that there's been a significant decline in program revenues, right, across the board. And also, a lot of nonprofits out there are realizing that they may or may not be able to do their normal fundraisers. So at the beginning, there was sort of this knee-jerk reaction. There was a lot of panic. I was in contact with a lot of my regular audit clients, and we were trying to see, what options were out there, what could be done. It became really important, this whole notion of having a reserve or having some kind of cash balance. Some organizations are pretty good at this. They're pretty conscious about the need to save for a rainy day, but there are others that are in this constant state of we just can't reserve anything. We just can't set any money aside. So in this current situation, it's made a huge difference for those that have been in a stronger balance sheet position, in a stronger liquidity position. So I think it's a very important lesson going into the future. Once we get over this hump, what are we going to do to really start creating this sort of cash reserve, this sort of rainy day fund? And a lot of it starts, I guess, at the board level. What kind of messages are our board members sending us? How is their involvement in our organization's strategic plan and our budgeting? And are we budgeting the right way? I still see a lot of organizations that feel that because they're nonprofits, they need to budget at a zero sum, or they shouldn't be too aggressive in trying to raise their prices to their services. And the answer is it's sort of a gray area. I mean, there's always an opportunity to revisit your fees. There's always an opportunity to look at your productivity, to look at what programs are really making revenue, or what programs are a really heavy burden to the organization. Of course, the other thing that I've seen a lot is this whole notion of teleconsulting. And just to piggyback on Bill's comment about capacity. Capacity normally is a constraint for a lot of nonprofits. What I've seen is that sometimes nonprofits, they're somewhat limited by their footprint. A really common example is, let's say, a nonprofit mid-size clinic or something around those lines. They only have one location. They're only in one place. So that has limited to grow into different areas of the city, or to try to attract different kinds of potential clients, right, or patients, or people that they're going to provide their services to. With this teleconsulting, it kind of forces us to rethink ourselves as to how are we increasing our footprint? How are we reaching out to other people in our community? My experience working with Bill, he has been really successful in doing this. If I remember correctly, and Bill, you might correct me if this is not right, but you originally formed Project Vida to help a particular community, right, which was the community close to Segundo Barrio. And now you guys are as far as Fort Stockton, and you guys are in Presidio, and you guys have different locations. You have a bigger
Fort
footprint.
Hancock, not Fort Stockton.
Fort Hancock, sorry.
Not that far yet.
Not far. But anyways, I mean, over the years, the organization has really expanded its footprint, and through a variety of different arrangements, right? You guys have mobile clinics, you guys have school-based clinics, you guys have leased buildings. The only building that you actually owe, I think you only actually owe 2 or 3 buildings, but you have multiple locations. Now, this whole notion of teleconsulting really challenges that, and really forces some organizations to think, if we're limited to just one office space, or we've always been on the west side, or we've always been central, does that need to be really who we are going forward? With teleconsulting, there's a lot of other implications that I'm seeing. In particular, how do we control the information for patients? How do you manage your HIPAA concerns, right? How do you protect confidentiality? Last night I was reading a really cool article about Sodexo that is coming up with this new software that is going to allow providers to actually log in their consultations and integrate them into their external billing software. And at the same time, it's going to ensure patient confidentiality, all for $300 a month, which I thought was a really good deal. And not to advertise what Sodexo is doing or anything, but that's just an example of how important technology is in this sort of changing realm of teleconsulting. So if you're not doing it now, in particular, if you're one of those nonprofits that really relies on seeing people and charging for a professional service like healthcare or like mental, behavioral health is what I'm trying to say, or something around those lines, are you really following this new trend? Do you have the right technology or not? And what do you need to access this technology? And then, of course, the last thing is managing productivity for our employees. There's been some challenges. Obviously, the first one is scheduling. How do you manage appointments? The other thing is, how do you actually reach out to clients if you don't have the same kind of office presence that you used to have? Are you reaching out to people through the social media? Are you reaching out through people to school districts? How are school districts channeling, potential new clients to you if there's no classes? I mean, there are some really challenging questions. And I guess the most important thing is to just keep an eye on what is our workforce doing? Are we using their time the most efficient way? And how can we keep them motivated so they can meet basically your targets, right?
Oh, that's great. Thank you, Teo. Before I ask you some questions here on programmatic fees and managing billing procedures, I saw some questions coming in, so I'll hand this over to Jana.
Thanks. Yeah, we have a couple of questions about a nonprofit's level of reserves. There are two related to that. The first,
Sure.
A healthy target for that level of reserve. And the second part is, how does a nonprofit establish a baseline of reserves to keep protective and not dipped into?
Okay, really good questions. So the first question is, what is a healthy reserve? I would say at a minimum, you might want to have 3 months of fixed, and by that I mean payroll. Your payroll period expense is, the more employees you have, obviously the more your cash reserve is going to be. I'm getting a message that the internet is unstable. I wonder if you can all hear me correctly.
I can hear you. You're a little sketchy on the on the video, but we can hear you. Now we can't.
Hello?
We've got you back.
Yeah.
We've got you back.
Sorry. I think I got disconnected there for about a minute or so. Let me just rephrase. The question was, what's a healthy reserve? And the answer is, it starts by looking at your most important expense, which is your payroll expense. You might have other fixed expenses that are very important. I don't know if you have a mortgage. I don't know if you have a lease, a rental arrangement that is very important to your organization. But normally it's your facility expenses and your personnel costs. And you want to have at a minimum, maybe a good 3 months. That would be the minimum standard. But best practice is probably something around the lines of 6 months of those personnel expenses and facility expenses. It's a little bit of an aggressive goal to get to those 6 months, but nonetheless, that should be your philosophy. And as long as you can get to those first 3 months of reserves, then you know that you have the comfort to have a good cushion to start with. The other question is, how do you actually protect your reserves? And that's a very important question, and there's actually a lot of different ways to do it. The starting point would be to set up a board policy, to set up a designated fund. Now, it's very common in the nonprofit realm or industry. I keep calling it industry. I'm not sure if that's the right term, but it's really common to talk about restricted donations, right? Restricted donations are directed by outside donors. However, what it's not very known about is that board members can also impose internal restrictions or designated funds. So it starts with a written policy. It starts with an action that is made by the board of directors, and management can certainly be involved and drive this. But you want to have some kind of written policy. You want to have some input from your board members to set aside a reservation of money. And it could be set aside for various reasons. It could be set aside for a particular program. It could be set aside as an emergency fund, or it could be set aside even as an investment fund, which is actually something that other nonprofits do very successfully. And then the restrictions could be very minimum, or they could be very stringent, depending on the board's, I guess, attitude towards the importance of keeping this reserve. On an extreme situation, not saying extreme because it's bad or anything, but extreme because it's a little bit more complicated. Some organizations have actually even opened a subsidiary or created a subsidiary in which they placed excess resources, sort of like a supporting foundation or a supporting organization. This is very common. It's actually more common than you might think. And it provides an additional layer of protection because you might have different board members. You might have some common board members between the two organizations, but nonetheless, you will require separate actions from these two organizations in order to move money from one entity to another. And if that's the case, it provides additional accountability for the operating segment of that group, because the operating segment of that group all of a sudden is responsible for a budget. And if you're not meeting that budget and you need additional resources from your foundation, then you need to be more accountable as to why you're going to dip in further into that reserve. So those are some examples, but ballpark, the beginning of this is starting having a policy with your board members that defines how are you going to protect this reserve.
Thank you so much for that. Jen, is there any other question before I move on to some more of mine?
Yes, there are a couple more.
Sure.
The next one is, are you aware of how other nonprofits in other cities have been preparing for a future crisis?
Right. Well, the main thing is managing the remote workforce, I would say. And something that is very important is keeping your organization's checks and balances in place. Now, there's a lot of new technology out there, and in El Paso, what I've seen is that there are some organizations that are big or mid-size, but their accounting software, their checks and balances are still sort of old school, per se. There are some really, important nonprofits that are still using things like QuickBooks or off-the-shelf accounting system. And it's not necessarily that it's wrong. It gets the work done, but unfortunately, these organizations keep growing, they keep changing, and it becomes harder to use these off-the-shelf accounting system. Something else that I still see a lot is that not a lot of organizations are moving into this whole cloud-based computing thing, or even a paperless-based system. So we still see a lot of organizations that are server-based, meaning that all their systems are located in a server that's in their same building. So if something were to happen to that building, all their information is there, right? Unfortunately, not a lot of organizations even know if their servers are being properly backed up, or if their servers have the right network security to prevent somebody from the outside to access their networks. So long story short, every year I see stories about people that get their servers hacked into. I see stories about a financial or professional at a nonprofit that has their information in a computer, and then that computer breaks, and then like for 2 or 3 months they don't have access to their records. So those are the kind of things that I would suggest that you look at within your organizations, and to really see how are we running our softwares, and is our information properly secured, and can we access it at any time? Can we access it from our home? And I'm sure that the answer is probably a mixed bag, right? There's probably some systems that you can't really work off remotely, and I wouldn't be surprised if the majority of you would tell me that most of your systems are still server-based or really, really office-based. So what I would suggest is to really look into that, really look into cloud computing and how you can move into accounting systems that are not server-based, that are not depending on someone's desktop, not going busted, but that you can actually always have in the cloud, and you can rely on that platform's security, right, to protect your information. The other thing is also the billing side. The billing side, a lot of the times it's not really thought about as part of the accounting side, but it's very important. The billing side is normally external. Normally most healthcare organizations will have an accounting software and a billing software. And sometimes we see that the billing technology is sort of lagging. There are still some good-sized nonprofits that have a portion of their billing that is still manual, and then a lot of it is outsourced. So if you're outsourcing your billing, how are you staying in touch with these outsourced billers that you're using, right, to keep your profit going? And then, of course, looking at segregation of duties is very important. In the last few years, I've unfortunately been involved in some audits in which they've been fraud discovered. And a lot of it has to do with having one person do too many things. And in the common scenario, in the common circumstances in which a lot of us are working remotely, there's just a lot more opportunity for someone that has too much access to all your information. And where we see it a lot is in the payroll cycle. Many times you will have one single person that is responsible for a lot of this cycle, right? For a lot of the payroll information. So you'll have one person that is able to actually change their own paycheck, that is actually able to cut himself an additional pay. And without the proper segregation of duties, it's very, very hard to identify these problems until the fraud has already occurred. So what I would suggest or even challenge you is to really think about the level of segregation of duties that you have in your checks and balances and whether you have the right system.
Thank you so much. Jana, is there another?
Oops, sorry. Yes, there's one more.
Okay.
How do you address donor funds designated for events that have been canceled due to the pandemic?
Okay, I've actually gotten a similar question, not quite the same. My suggestion would be to reach out to your donors and just explain that maybe if there's a possibility to repurpose some of those funds, that would be the starting point. And my impression is that most donors would certainly be flexible enough to allow different uses of those funds. Normally at special events, the proceeds from special events are normally undesignated. So ultimately, if there's a profit made from a fundraising event or from a special event, that segment of the revenues are normally directed to overhead. They're normally directed to pay expenses that are not otherwise covered by a grant or other sources of revenues, right? So maybe explaining that to donors would be the most important starting point. Another maybe less popular option would be to save those funds to the next year or to try to create another program that is very similar. One year in a nonprofit that I was involved as a board member some years ago, we did sort of a sleep-in fundraiser because we didn't want to have our donor base, being, I guess, year after year asking them to attend these events. So we figured, okay, let's give our donors a break, and instead of having them come to an event when they're busy, and we're just going to have them provide some support, and we're going to tell them what the support is for. We did this for scholarships. We were actually very successful, believe it or not. So it's just some ways to maybe think outside the box, and maybe just not because you're not having your event, it doesn't mean that you're not really going to fulfill your mission. And explaining that to your donors, maybe through a campaign in the intranet, or maybe just picking up the phone and calling them if you have that kind of connection with them.
Great. Thank you for all that. I'm sure it's helpful. Let's move on to some transformation questions. And I would like to start with just asking you, when should a nonprofit consider kind of creating these different legal entities you've mentioned before?
Okay.
And then talk to us a little bit about collaborations, affiliations, arrangements with others. So if you're really not going to create or even merge, what's something less they can do, but still expand? Okay, tell us a little bit about that.
Okay, so certainly, I do see this every once in a while as well. It all starts with going into a new direction, right? Like Bill was saying, if there's a need to fulfill a new program, what are going to be the implications to your nonprofit if you're going to venture into something else? And the answer is very complex, but I can give you some very, very specific scenarios. If you're going to be looking to apply for some kind of grant funding, right, for some kind of federal program or state program, sometimes some of these programs are going to place certain requirements on your nonprofit. I'll give you an example. There's the CHOTO program. The CHOTO program is a designation from the Department of Housing and Urban Development. So if you want to apply for home loans, right, to do this rehabilitations of existing properties under the home program, you need to be qualified as a CHOTO, right, by the legislation that's going to award you those funds, which here would be the city of El Paso. So if you want to be a CHOTO, first of all, a third of your assets need to be dedicated to low-income housing. So if you're a healthcare organization and all of a sudden 1/3 of your assets are going to be diverted to low-income housing, well, how do you manage that? And maybe the answer is let's establish a subsidiary and let's not worry about managing those restrictions in our existing nonprofit. That's a good, really good strategy. Also, board composition. In the example of Bill, the health center side of Bill's operation has some very specific board composition requirements, right? The members of the board need to be patients of a FQHC in this case. So how does that impact Project Vita's board? Well, instead of doing that, let's just have a subsidiary and have the subsidiary deal with those requirements of board composition. There could be other things. I mean, there's also maybe religious implications, right? And it's very important in housing. Housing programs managed by the federal government, they have some certain political positions that may not align with the organization's mission, especially if they have a religious background. So in this kind of scenarios, it makes a lot of sense to go the route of having a subsidiary. If you're going to be imposed to different requirements, then you want to have separation. Of course, there's also the matter of protecting your organization against any kind of legal action. And it depends on the kind of business that you're going to be venturing on. I know that, for example, the rescue mission, they established a limited liability company to spin off this new, well, it's not really new anymore, but this new venture in which they're doing a catering business. And the reason they're doing that is because they felt that that was the correct structure to provide liability protection for that particular program. And it's actually separate from the rescue mission, which I think is very ingenious as well. But nonetheless, it has to do with the requirements of the new program, with maintaining certain credentials, and with the kind of legal protection that you want to have. And if you don't have any kinds of worries of that nature, it might just be a good idea to stick with your organization. You don't always need to start establishing a subsidiary. Another thing that's also very important, before I forget, if you're going to be involved in some kind of advocacy, if you're going to have some kind of political position, if you're going to be doing some kind of grassroots level lobbying, or something that could be interpreted as lobbying, it doesn't necessarily need to be lobbying, you might want to be very careful about separating those activities from your existing nonprofits. And you'd be surprised at doing these kinds of activities. What I've seen in my experience, I have a few clients that are very vocal like this. It really attracts a very particular segment of donors, right? And it gives you access to tap into different kinds of funds from a different segment of the population, or from different political groups, or from different action groups that maybe you wouldn't be comfortable tapping into under your current nonprofit. So if you're going to have a very vocal organization or very vocal sort of subsidiary, you might want to even consider a different kind of tax exemption for this subsidiary that's going to be doing advocacy. And there are different kinds of tax exemptions for organizations that are allowed to do lobbying and political activities. And normally those donations are not tax deductible. So if you're going that direction, if that's part of your strategy, then it makes a lot of sense to have subsidiaries to where the advocacy is in one place and the operations are sort of sealed from that advocacy activity. And the last thing is, of course, looking at how you're going to form this organization. Who is going to be controlling it? Is it going to be the same group of board members? Is the executive director of the operations going to be responsible for being in the board member for the other organization? Does one organization have control to appoint the board members of the other organization? depending on how those things are set up, the IRS is going to give you a different kind of tax exempt status, right? So if you're completely independent, each organization can have its own 501c3 status and be completely independent. And if you have more control, then the sort of the child organization is basically a supporting organization. And then there's some different tax requirements for supporting organizations in this case. So it's very important that you consult not only with your accountant, but also with your attorneys, right? Because accountants shouldn't be writing bylaws or doing these kinds of things, but then also the attorneys need to be involved of the tax consequences that this might have.
Great.
And then the other question was collaboration, and really quick, I wish I had more time to talk about this, but with collaboration, what I've seen is that sometimes, there's an opportunity to partner up with another organization. And the ideal situation is you want to be able to raise, revenues, make this a profitable enterprise. And there's various ways of doing it. What I've seen is that one company charges admin fees to the other company. And normally it's the one that has the most experience or has an idle employee that they're going to share. You can also just keep track of the expenses for that idle employee or for whatever that you're sharing and split those expenses between the two organizations. That's a little bit more complex, but it works very well if you have the capacity to do that in your accounting system.
So I did see a couple more questions come in, I think, Jana. Anything there?
Yes, there's just some clarifying questions about subsidiaries. The specific legal parameters, and if there's a specific designation outside of the nonprofit status. And then a second question is, what kind of consultants would you want to engage if you were interested in this?
Okay, so legal parameters. It's probably better to go with a corporation if you're going to form a subsidiary, because it's easier to get the status approved. And it's also the state of Texas is a little bit more lenient in approving exempt status for a corporation than for an LLC. If you form an LLC, you can still get a tax exemption, but with the state, you just need to do additional explaining with the state as to why are you an LLC, but you're not going to pay franchise taxes. But it can be done. It can't be done on either way. Either whether being an LLC or whether you're a corporation. Now, there are certain important things that need to be written down in the formation documents of any new subsidiary. And I'm not an expert on this. Again, this is more of a legal question, but my experience is that the IRS will see whether your formation documents specifically identify you as an exempt purpose organization. And then the other thing is that these documents need to say that when the new corporation is terminated, any remaining assets are going to go to another nonprofit. And the other nonprofit can be the parent company that created this, or it could be any other nonprofit, right? It's up to you how you do that. But those are the two minimum requirements as far as setting up the legal structure. And again, this is a really broad topic, but if you don't have those two things, the IRS will not approve you as an exempt organization. What was the other question? I'm sorry. I got a little sidetracked there with this one.
What kind of consultants would you want
what kind of consultants?
If you're interested?
Right. So it would definitely be both an attorney to draft the documents, and it would be a CPA to help you get the tax exemption approved. Attorneys can also do that, but if you're working closely with an auditor, with a CPA firm, they know a little bit more about your programs, and they might be a little bit more efficient in writing the application for exempt status, because you do need to file an application for exempt status, which is Form 1023, and it's really a narrative form and has a lot of quantitative information and qualitative information. So a CPA may be better suited to prepare the application, but an attorney is definitely better suited to draft the organizational documents.
Great. Thank you, Teo. So before we kind of move on, do you have any kind of closing comments about other things you've seen or recommendations you would make to an organization that says, hey, I really want to prepare myself financially, accounting systems, physically, for any type of crisis or in the future? or thinking about really changing themselves, a line of service, a program that may not be receiving fees the way they want, or partnerships. Any kind of closing comments?
Yeah, I have a lot, but I will
Take your time. You
summarize
got a
in a
little time.
few. Yeah, I'll try to summarize it. So the first thing is looking at your board composition. Do we have the right mix of persons in our board, and is it diverse enough, right? Often I see that board members that have background in finance, they are a little bit more comfortable getting involved in the weeds, or a little bit more comfortable addressing an organization's balance sheet, addressing an organization's budget. If you don't have those kinds of persons in your board, you might want to consider leveraging that with a finance committee. You can bring people outside, former finance committee, that's going to provide that kind of support to your organization. But the more involved your board is in your finances, and the more accountable is the organization towards performance and keeping up with their budget. So that would be one thing. The other thing is taking a really close look at your revenue generating cycle. And when I say that, I mean billings. I often see organizations that start growing, they hire more providers, they start seeing more people, but it doesn't quite translate into additional revenue. It doesn't quite translate into more profitability. And you got to ask yourselves, is this happening to you? Why is it? Are we not properly billing for our services? Maybe our services are not properly priced. And if they are we doing a good job in actually billing for these things? Are we segregating our billing function? And if we are, how are we holding our consultants accountable for doing billing the right way? And how does our billing, particularly if you do a lot of medical and insurance billing, how does that billing compare to other peers? Is our bad debt expense in an acceptable range? Are billings taking more than 30 or 40 days to get in? Do we have a lot of rejected claims? You got to ask yourself those questions, and you need to tighten the belt as much as you can on this particular cycle, especially if you have a complicated sort of a billing transaction. And then the last thing is just look at your segregation of duties. Do I have the right systems in place? And do I have enough segregation of duties? Do I really trust my accounting right now? Would I have to spend a lot of time to put it in the right place before the audit starts, or before somebody else asks for information? And if that's the question, then the answer should be, when are you going to change that? What are you going to do to have the right information available and have the right checks and balances in place?
Thank you so much. I saw some nice comments coming in the chat section. So, I encourage people to keep up with that. Jenna, any pressing questions out there? Okay, very good. So let's move on. And, I may come back to Bill or Teo here. As we get ready to transition over to Bruce Parsons and our Realized panel, I want to remind people that this RFP process is what we call a two-stage process. The first stage is the letter of intent. And if the letter of intent is accepted, you move on to a second stage, which is the request for proposal. So one of the more common questions we get at the foundation is, hey, I have an idea, let me tell you about it. Do you think I'm a good organization for this? Would you fund something like this? That's the whole purpose of the LOI process. So I would encourage you, just submit one or even two LOIs, tell us the idea, take a good look at the requirements for this process. You must be a 501c3 in the United States or an AC in our service area in Mexico. And just submit the letter of intent. If your letter of intent is accepted for stage 2, we'll have at least one, maybe two more kind of sessions like this that are really more specific to the request for proposal. These are more just to get you thinking about what's possible, what isn't otherwise covered by paycheck protection or city or federal money that I need help in really changing my organization to meet the needs of the community we serve. For those organizations then that are funded, what I hope to do is set up some support structures for you so that as time progresses, there's some opportunity for sharing, for coaching, for board development, for reflection that is really more purposeful and planned. The Paso del Norte Health Foundation is really less of a we give out money and more we help finance good strategy for change. So we're really looking for some nonprofits that want to have some great strategy for recovery, preparedness, and transformation so that we can finance those strategies. So Bruce, I think you're there. Bruce Parsons is a graduate of our first Realize Executive cohort, and he is also the past associate director, assistant director of the El Paso Health Department. He does have a background in foundation work, recently retired, and I've asked him to put together a panel of other Realize graduates and focus mostly today on transformation, what they're thinking about transformation of their organizations or how they kind of think through this. So Bruce, let me hand this over to you to introduce your panel and take it from here.
Thank you, Michael, and thanks everyone for joining us today. As I was listening to Bill and Tejo, my first thought about Bill was he packs a lot of punch in a few words. I mean, that's just the way he addresses folks. And a couple of the takeaways from Bill Schlesinger this morning, sometimes we hang on to a position rather than a value. I think that's when we have situations like this is the time to kind of reinforce and go back to our true values and not just think about positions on things. And then strength is not in autonomy. And I think that's a message for all of us that strength is multiplied exponentially as we establish relationships across the community with other like-purposed organizations. And Teo, thanks for the good advice on cash reserves, supporting an organization. I think that's a relatively new concept for a lot of people. Cloud computing, and probably most significant based on my personal experience, segregation of duties. Kind of early in my career, I was director of a nonprofit where a bookkeeper forged my signature and the board chairman's signature on a check and absconded with $50,000. So I know what can happen when you don't have segregation of duties. And I think just based on your remarks today, you're going to get a following from the people who are on this call. In fact, you might even get some groupies who will chase you around because you've provided some great advice for everyone today. Now, if I could have my first slide, Claudia. Thank you. As we've done in the past two sessions, we're starting today with a definition. I think definitions are important primarily because they give us a common understanding of a word. And transformation, as you know, is a thorough or dramatic change. And when we think about that contextually, a thorough or dramatic change is not just putting different color paint on an old wall. I mean, it could be moving the wall, or in some cases, eliminating the wall completely. So it's just, it has to be something that's significant. And I think that's reflected in the definition. But it doesn't have to be something new. I think Michael was alluding earlier to how sometimes, we can go back to our original mission, go back to some of our original programming, and that can be transformative as well. It doesn't have to be a new or better mousetrap. It could be improving upon what was originally the purpose of establishing the nonprofit and doing that work once again as a lead service. So next slide, please. Today we have with us for our Realize panelists, and for those who are joining the first time, the year refers to the class that these Realize graduates were in. We have Kathy Catan from El Paso Child Guidance Center, Stephen Engel from Creative Kids, and Kristen Aguilar from La Semilla Food Center. Next slide, please. I think this was also talked about earlier. I think when we look at our array of services that we do, sometimes nonprofits over the course of their development or their history end up doing things that might get them a higher level of visibility, higher profile in the community, may get them additional revenue that they can use to cross-subsidize other things, but aren't necessarily germane to their mission or to their purpose. And though, as Bill mentioned earlier, that the mission can change and adapt and should change and adapt to changing needs in the community, there are certain things that nonprofits do that may not necessarily be relevant to why they were set up in the first place. And the risk of that is what I like to call mission drift or mission strain, that that works if you could just click, yeah, no, you can't, right? Yeah, if that was from Annie, get your gun. Anything you can do, I can do better. I can do anything better than you. And Frank responds, no, you can't. So this idea that just because we're doing it and we feel we're doing it well, or it's giving us a higher visibility in the community or more money, that we should continue to do it. And when we have an opportunity such as the pandemic, it kind of gives us an opportunity to rethink that. Next slide. And so what does all that mean? Well, we can focus on services, as several people have already commented, that are truly needed by the community. Will not be done well by the private sector or done at all because there's no potential for profit, and that you do well and that you're good at. And I think that sometimes we default into certain services as nonprofits because we can do them, but we're not necessarily the best at them or even good at them relative to other providers in the community. So again, this pandemic has given us an opportunity to rethink that. Next slide. So the opportunity of this particular RFP, as Michael alluded to, is that it gives us as a community and all of the nonprofits in the community that would be eligible for participating in the RFP, the chance to kind of rethink not only what we do, but what we do alone and what we do with others. And as Michael referenced, they're really looking for good change strategies that maximize value to the community, and that not just to the nonprofit that's the applicant, but to the community, and that's really the driver. Next slide. Oh, and thank you, Claudia, for that click. Wasn't next slide, it was click. That we're really talking about the possible, not just the probable. So I think the foundation, as Michael has alluded to earlier and on earlier sessions, they're looking for ideas, they're looking for potentialities, they're looking for new possibilities, not the absolute probable, not the absolute guarantee. Next slide. Which takes us kind of to the last slide that will be the frame of our discussion this morning with the Realize graduates, our panel. Thank you again for all three of them and their willingness to participate. And that is to look at this developmental model for transformation. And if we think about that kind of the y-axis being risk and benefit, and the x-axis meaning higher degrees as we move along that line or that continuum, higher degrees of working with one another, relating to one another organizationally. Normally, in normal times, that vector would really be trust. It would be as we develop trusted relationships and build upon them, we're willing to move into higher degrees of interaction with each other. But this pandemic has really provided us another driver. So if we look at that vector in the context of COVID-19, it's really economic distress, and there might be opportunities that come about because of the amount of economic distress that a nonprofit is having, where normally that kind of driver would be gradual and volitional, and now it seems to be almost involuntary because of the demands, the finance demands that have been placed upon nonprofits as they try to survive and prosper in this environment. But if we look at just those four categories, I think you can see, and you look at the descriptors beneath the economic distress line, cooperation, which we often, I think, my humble opinion, I think we often refer to that as collaboration, and that's not collaboration, it's cooperation. That's like sharing a table at a health fair, right? I mean, you got two organizations sharing a table at a health fair. Separate resources, separate management, separate governance. They're cooperating, obviously, at that health fair, but that's kind of a self-limiting, limited investment and self-limited in time. And then we move on to higher degrees of coordination and collaboration. And maybe on a collaboration side, there's actually two organizations doing the same thing, and they're contributing staff from each organization to those functions, and they might be divvying up a geographic area, they might be divvying up a target population, might be divvying up a schedule for provision of those services. And so there's still separate governance, but there's a greater degree of sharing of resources and management of those resources. And then finally, you get to that point of merger, where there's actually dissolution of one organization, or maybe two or more organizations, and the formation of something new. Management's merged, the resources and services merged, and under new governance. And so that would be that kind of full integrated model. And so with that kind of as our framework for this morning's discussion, now I'll start with our questions for the panel, and they will respond in the order of Kathy, Stephen, and Kristen. I appreciate that, Kathy, your willingness to go first. Great.
I don't think
Thank
that
you.
was a choice.
All right, the first question. COVID-19 has been disruptive and destructive to our community. The virus has stolen precious lives and changed how and whether we work, how we socialize, how we educate and shop, and how we worship. It's changed the way we live. How has the COVID-19 pandemic rattled your organization, and where do you see your organization along that economic distress vector?
So I think that clearly it's rattled our organization in a lot of different ways. One is at a very basic level, looking at our mission, vision, and values. And I know values have been talked about a lot this morning, but at a very basic level, are we still needed? Why we were first created, is that still important? Is our vision still attainable? Those very foundational questions are things that we're asking ourselves right now. So that's part of the rattling. I think another piece of the rattling has been around our governance structure in terms of our board. I think sometimes boards, in terms of holding each other accountable at participating and showing up and doing the work can be a challenge. So in our organization, when the pandemic first hit, we needed to move on a lot of action items. We needed to get things passed. And so I think the board had to look at, now's the time to enforce who's in and who's out so that we can move forward on some stuff. So that was another challenge that we faced. I think overall in the fluid environment that we're swimming around in right now, the concept of structure and planning being psychological safety is being challenged in and of itself. So I think for a while we had our heads down, probably as most people did, safety, keep our doors open, continue to provide services, and the shift from keeping our heads down to lifting up and looking forward in such an uncertain time has been very challenging for staff and board sometimes, because it sparks a lot of fear. and especially the concept of uncertainty. So that has also been really challenging. So we're sticking with, you know, we can do this, keep your head up, and let's challenge ourselves in really asking these outside the box questions. A lot of stuff that Teo was talking about, very intriguing. And it's hard to make that shift when you've been so focused on some very concrete activities and strategies that you're implementing now to save the ship. So I think that's been something else that's been very rattling.
All right. Thank you, Kathy. And now along that economic distress vector, would you consider yourself still at the kind of the early stages rather than one where your organization's finances are driving more radical change?
I think that we're moving out of the phase where finances were driving some radical change. We're shifting out of that mindset. We try to do our best to hold organizational culture and fiscal together, to not compromise one over the other. So we've stabilized in a lot of ways. So I think that we're now moving further along the spectrum. And I thought it was a very interesting point about the economics being the driver versus the trust being the driver historically. That goes back to fiscal and culture together. And I think it's challenging. And we're in a particular position where we're not looking at closing our doors right now. So we're not in that position. And I definitely acknowledge that. So maybe trust is a luxury on some level. I don't know, but we're holding both, doing the best we can.
Thank you. Stephen.
Hey, how you doing? I think when we started looking at what the dilemmas would be with what we do in our mission and vision, we were very lucky to have a strategy that was placed, looking at our pegs, what our skill sets are. And we sat down for a little bit and looked at those pegs. What do we deliver in education and service? Where's our locations? And what are our partners going through, and what pain are they feeling first? Whether it was they had to close their doors, being a school system or a hospital setting, when can we kind of regroup and talk to them about how we strategize together? Well, we went through a shock period, but luckily we had a strategy that was laid out. And because our organization is creative and using ideas and problem solving, and also we adapt technology, we already had those systems of technology in place. We just didn't see our partners ready for that. And so we were able to kind of bridge that gap and say we can still be a part of the process of productivity, and we can still reach further as long as we work together and communicate. So I think as we looked at our pegs and what we were strong in, our curriculum was great. Our technology platform was there. It just had to be collaborated and communicated to our other partners. So whether it was the Boys and Girls Club or the hospital or things we do in after school, we were able to overcome that by conversation and communication on how can we work together. But it was also looking at the finances and having honest conversations with not only our staff, but ourselves. And also, I think like we discussed earlier today, we have always saved for a rainy day. It was, you know, as a nonprofit, we all know that nonprofits are always looking for money. So there is no better thing to set up than a rainy day fund. And it's also to have an infinity mindset. One day I'm not going to be the co-founder or be a part of Creative Kids, but Creative Kids has to go on. So in order to do that, I think beyond myself, and I hopefully tackle what I can to make it easier for the next person in my position. So that was the mindset that got us, you know, stabilized, thinking correctly, and moving in a very productive, but also communicative manner, because it wasn't just the money, the funding, but it was also restructuring and communicating, and it's all happening at once. So you really have to develop a level of balance to look at things, take time on those things, and also reach out to people that are that are better at those things and know those things more. So I think that was our first step as an organization and as a staff, is going back to the strategy and then pushing it forward.
Thank you, Stephen. Kristen.
Yeah, hi everyone. Yeah, so our program, our organization has several programs and moving pieces. I'm not sure, we have 5 different programs and we work on a lot of different fronts. So we have a community farm and we do educational programming and we work directly with schools. We do policy advocacy, we do business development, right? So each one of our programs had very unique needs and was affected in really different ways when COVID hit. So on one hand, the first thing we did was, and this is something that's been cultivated culturally in our organization for a while too, was to step back and take a breath for like a week, right? Like, and there was this big pressure on everybody to like, we need to respond now, we need to pivot, and we need to make a decision and do all of these things. And we knew that if we did that without really considering what our community needs, what our partners needed, what our staff needed to stay safe and healthy, we were going to take some missteps. So we took that time to really focus in on kind of these big pieces and figure out how are we going to carry this forward? How do we do education with all of our program participants? What does that move to virtual look like? How do we do our back end and our policy advocacy work, right? Like what are those software needs? How are we making sure things are digitized? Like how are we keeping our 22 staff members employed and paid, and how are we supporting those people? And then there's the food production piece, right? Because as soon as COVID hit, these systems that we've known for a very long time are fragile, started crashing down, right? Like our food system, there were disruptions in the food supply, meat packing plants have been a huge issue. All of these things were coming to the forefront that we'd always known were an issue, and we'd been slowly working towards addressing these needs. But all of a sudden you have this weird thing in here where all of a sudden you have small farmers who need to use, for a very specific example, a wash and pack to wash their produce, but everybody needs to be 6 feet apart, right? We need to talk about social distancing, we need to talk about food safety, and if they've traveled, and can they touch the food? So all of these things were piling up, and it was a very intense few weeks to figure out all of these moving parts. I think one of the things that helped us through that was that we're very focused on an alternative way of operating already. We already are thinking about shared leadership and what that looks like, and cultivating resiliency both in our organization but in our communities. And we know that that resiliency is one of the biggest, one of our great gifts that we have as a community is this resilience. It's been cultivated over, decades. So, and I think really focusing on relationships at every level, from, I think Stephen mentioned this too, or several people have mentioned this, right? Like it's your program participants and checking on them and how are they feeling? Because all of a sudden there's this disconnect, and our cultures are very much family oriented and community oriented, right? And all of a sudden, if you're not supposed to go see your grandparents and you're not able to come to our group with your friends and like talk through all of this stuff, what are you doing? But really focusing on the relationships and what's needed at our staff, with our program participants, and also with our funders, right? Like that was incredibly important. So I guess it rattled a lot of ways, and it's been a little scary, especially on the food system side and the lack of food and the kind of distress that people are in, that farm workers are in, that families not being able to access food is in, that, loss of jobs, loss of income, that's kind of come to the forefront. So I think there's a lot to still be done on that end. And we've kind of, on that economic distress continuum, we often fall kind of between that coordination and collaboration piece with several partners anyway, especially small farmers with shared resources, shared use equipment, having a lot of community input into how that's used and what that looks like, and what cooperatively owned and shared equipment looks like, for an example. So we generally fall along somewhere between coordination and true collaboration on that spectrum, and probably more so going forward.
Thank you so much. I'll just do a couple of takeaways, and then we do have a couple of questions in the chat room. Jana, if you could take the lead on that, I'd appreciate it. Kathy, one of the things that you said right at the outset was that you started asking foundational questions, and I think that's really important. That, you know, again, it's not, you know, new color paint on the wall. You're asking the very core questions about your purpose of being as an organization, and again, this is an opportunity for that to happen. And then how do you compose or make up a board or structure a board so that you can maximize the value of that board, and, you know, combining the talents. Teo referenced that earlier about getting the right people on the board and what difference that can make to the organization. And then Stephen, I was pleased to hear that you said that you had, you said that there was a shock period, but that shock was mitigated by strategy, that you had devoted time, attention, you know, to developing a strategy for response. And so there's mitigation effect that goes with even the slam of the pandemic, if you've given thought to how you're going to respond to not only your programming, but how you relate to your partners. And that you have a rainy day fund, and which I think is great, but most of us would settle just for the rain if we could get some rain, you know, in our area. But again, the fact that you've planned, that's helped mitigate the effect of this because you did have funds available. And then Kristen, I thought one of the most important messages was this: step back and take a breath. You know, that everybody's getting hit with this at the same time. There's no reason that you have to speak before you can think things through, and that's it's that old seamstress adage, you know, measure twice, cut once, right? Because you can make some serious mistakes if you act impulsively when there's no need to act impulsively, especially. And then the fact that you've already had a shared leadership model, and so, you know, a lot of that operational stuff and sharing of authority and responsibility is already built into La Semilla. And then, so thank you for all those comments. Jana, if you could go to the questions.
Sure. I have one for Kathy and then one for Kristen. Kathy, can you say more about trust as a luxury?
Sure. Well, there was a private chat going on where there was discussion around, did I mean life, or are we talking about depravity, all kinds of stuff. So I think, you know, there are some very large questions in there. What I was referring to is that when the pandemic first hit, I was talking to a funder who said, look, you guys are very resilient as an organization. I'm going to tell you this now. I highly recommend that you start asking yourselves these very big questions so that you don't get in a position where you have a forced merge or a forced collaboration where trust becomes not a factor. So that's what I was referring to. Whereas if you have time and you have reserves and you have other things going for you, that hopefully, you know, it's not a forced thing, and you have time and you can pick and choose, and you can merge with or share back office or anywhere on that spectrum that we're talking about, you can engage in those activities, which I think would have a higher potential for success. Because I think, at least in my experience, when we've engaged in collaborative efforts or cooperative efforts where there is not trust or a foundation of a relationship, that we have learned the hard way that we come from very different mindsets and different values, and that affects outcomes, which affects clients.
Thanks, Kathy. And then Kristen, can you say more about what shared leadership looks like in La Semilla?
Yeah, for sure. It's kind of a great follow-on to Kathy just now, actually, because, right, the root of what shared leadership is it takes a ton of time and a ton of trust and a ton of communication to operate effectively. I think it inherently will imbue you with a lot of resilience organizationally and in your community, ultimately, and it's over and above, like, worth the effort that it takes to do it. I think a lot of people in here, if not everyone, most people are a nonprofit. If you're in a director or leadership role, burnout is something that is just like so overwhelming in our sector. And I think we need all of our people, all of you all, right, to be able to continue doing this work. And one of the ways that we found to mitigate some of that and to really focus on resiliency has been the shared leadership. And so we have 2 co-executive directors. And so we're not a flat structure at all. There are some organizations, believe it or not, that are a flat structure with no hierarchy, which is a whole other level, I think, of shared leadership and what that can look like. And I think it's also looking forward to not what's just probable, but what is possible, right? I think we have to be really creative and be open to imagining like what these things could be. And I think we have a really good opportunity now as we're thinking about how things are set up or what these might look like, collaborating with other organizations. I think there's such a good opportunity to do that. And it's not less work, right? Like sharing the load is not less work, it's more work. It's like a relationship. As much work as you have to put into your marriage or, you know, into like raising your children, that's how much you have to put into shared leadership. But yeah, it's probably a much longer conversation, but if anybody is interested in hearing more about like the actual structure and how it works and the process, I'd be more than happy to share that offline.
Thank you. Thank you, Jana. Thank you, Kristen. Our second question is, in the developmental model for transformation, all the stages of interaction involve working with others from merely cooperating to full integration. What have you done to identify and develop partnerships related to your current or your anticipated stage of development? That is, where you fall on that cooperation to integration line. So what have you done to develop, identify and develop partnerships? Kathy?
I think that the first thing I have done as an executive director is to evaluate my leadership style and my philosophy. So what I mean by that is I do my best to adhere to a servant leadership philosophy, so that lends itself to the investment and interest in collaboration. And I think that the leaders in our organization adhere to that as well. So I think that's one of the factors there, is where I come from as a leader and leaders in our organization. Another aspect, I think, is the investment in time, that it takes time to build relationships. So we've been doing that for a long time because there's a high value on relationship. So by that, I mean, we spend a lot of time on the phone with our partners and collaborators and with people that we are in meetings with. We do follow-ups. So there's a lot of time in calling people and saying, what did you think about that? Where are you in this? So that's been going on for a long time. So in a situation like what's happening now, I think now is when we lean on those relationships and those trusts, because I've made a lot of phone calls on cell phones. Where are you? How are you? How are you personally? How's your family? How's your organization? What are you thinking? What are you guys going through? And I think that becomes an organic process where you move along that continuum. And then I think, again, you have a better chance of success because you're being mindful of it and you're leaning on that core foundation. And then I think the other thing we've done along the way is we've made a heavy investment in community collaboratives. The Family Leadership Council is a great example, where all the child serving organizations come together once every other month. That has created and forged great bonds and relationships. And so an investment in those types of community-oriented forums and discussion groups and work groups is another thing that we've done to have better relationships and collaborations.
Thank you. Stephen?
It's very similar. I think the first thing I did is I sat down with my staff and I basically laid out what I had seen coming, which is the pandemic is coming, but also we're going to go through an economic crisis. And we're also going to go through a structural change. And I wanted to build the relationship first with the people I see every day so that I can align with them and they can trust me, that I'm going to tell you the truth every time you see me, what it will be in a week, what it will be like in 2 weeks. And then we had that same conversation once everybody kind of laid it out, cried a little bit, understood that we were going through some changes, and there might be a pivot that's not going to be, accepted very well, but it had to be something we had to be completely honest about, because there might be a situation where I'll come in with something negative, because it might happen. And then the second one was doing that same thing with the board and saying, you know, the relationship of you being on the board, I really, really admire each of your skill sets. So I'm going to call each one of you and I'm going to ask you what you think and what you're seeing. And I just wanted their buy-in to say, can I call you? Can we talk about the hospital? Can we talk about the school district? Can we talk about economics? Can we talk about Wall Street? Can we talk about health crisis? Can we talk about politics? Can we talk about what you think my idea is and why it might be wrong in that space of healthcare, or the way economics are going, or sales tax towards the school district? Plus, I reached out to our partners like the Boys and Girls Club and other friends of ours, and I said, what are you going through? What's happening over there? How can I help? What are the situations? Are you taking PPP? What are your steps? Where are you going through this? And by doing that, I not only strengthened my relationship with them, but I gave them the open door to call me if you need me. Like if you need something, either technology driven, or you need me to help you to pivot, we're in it together. So with those conversations, I think it built trust with everybody having an honest discussion and really a positive attitude. And I think that was the key towards moving towards a transformation and seeing that we needed to make change. And it's not necessarily a bad thing. I mean, not everything is bad that we're going through. We can make it good, but we have to do it together. So I think that led us to really creating the relationships that were strong and honest. And, you know, when somebody would call me or I would call them, we could spend a half hour together and talk about life and where we're going together. And I think that was impactful and gave me the opportunity to grow and see different opinions. So I suggest that for everybody. And I think we're going to continue to do that every 2 weeks from now until forever. I'm just going to talk to people as much as I can so that I get their input and buy-in on decisions that are being made.
Thank you, Stephen. Kristen.
Yeah, I don't know if I have much to add. I think Kathy and Stephen really covered a lot, and this might be repetitive, right? But these relationships and investing in that, I think, cannot be hammered home enough. You can't move faster than the speed of relationships and do good work, right? That's just kind of the bottom line. So, and I guess the one other thing I would add is kind of everything old is new again, right? When we're talking about transformation, it's not just like something new that we've never thought of. It might be going back and relying on old ways of being, right? Like, or like this ancestral knowledge that our communities have had for a very long time, and ways of providing mutual aid and support. That has been there. That's not something new, but it's something that has been lost, I think. So really kind of going back and relying on, you know, everything old is new again, and really focusing on supporting from the bottom up, I think has been really important in determining how partnerships develop and how we cultivate and support that.
Thank you. Yes, it's so true, especially given that the nature of your business is agriculture. You know, and when we think, you know, going back literally, not just figuratively, to the roots, right? To the roots of relationship. Kathy, talking about servant leadership style, I think that was really important. That was a critical factor. You just, if you orient yourself in your leadership style to one of service, that you're a servant leader, then a lot of these other things just fall into place because they fit in to that value structure. Investment of time, Stephen and Kathy both talked about the investment of time. And one of the things I heard, I think it was Kathy who said, you have to lean on relationships. You have to lean on them. And sometimes that leaning is not a comfortable thing, you know, where you have to reach out to people and literally express your vulnerability to them in different ways and ask for their assistance. And none of us, or at least most of us, don't like to do that as a rule. You know, we don't want to appear vulnerable, and this has required us to do so. So thank you all three for your comments. Next question, do we have any questions in the box? No. Next question is, the COVID-19 response provides an opportunity to rethink what services your organization is providing, to whom, at what cost, and what value to the recipients in the community. Have you and your respective boards addressed your current portfolio of services relative to what should be continued, what could be divested or transferred to other organizations? Kathy?
I think we have definitely done that on a consistent basis at the staff and director level in our organization. I think we continuously ask ourselves those questions. What do we need to keep? What do we need to go away? What does somebody else do better that's more fit for someone else? We ask those questions, excuse me, of ourselves a lot. I think at the board level, they're starting to do that more often, especially right now, because it's such an important question. I think one thing COVID has pushed us to do as an organization is improve our data collection and analysis and realize the challenges that we face in collecting effective data, especially from a fiscal lens. Goes back to, I think, some of what Teo was talking about, accounting systems, billing systems, off the shelf, what needs to be customized. So I think that's an important layer of challenge that we're currently faced with. So I think that we're doing the best we can with what we have, and we're envisioning what we need to create and have to make better data-driven decisions. We're doing more surveying of staff and surveying of clients to understand what's needed, and surveying the public. So that's another level of analysis. So I think that even the questions in some of your slides earlier, Bruce, about I can't remember all of them, but there were some very thought-provoking questions about programming and how we analyze what's working and what's not, and what do we need to keep and move away from.
Thank you. Stephen?
So I think where we're at currently is that we went back to what we're really good at, and that was curriculum. We were able to write a curriculum that was integrating a lot of ideas around mathematics and linguistics, history, science, all those things through an art process for kids. And we moved into using technology even more affirmative, and what we're going to pivot into is not only working on the timelines of organizations like the healthcare system and what's happening in the school system, and just keep pivoting on those, but our new strategy is to make our curriculum now launched online. So we're launching today, Making Art Possible, which has all the training videos that we've put out for the Boys and Girls Club. But we are now collaborating with a friend of ours from Microsoft and also from the Texas workforce to work on moving forward and training more educators, not only in after school, but also integrating into the school day by TEA training hours that we can give up, to helping teachers integrate this online process that they might have to do at a distance, but also give projects to kids at home that I think is integrating not only their problem solving, but relieving them from this Zoom anxiety, and also from the parents. So I'm happy to announce we're looking backwards still to what we've been doing locally, but we're also moving into new ground and trying to be not only resilient, but shooting with the curve. So ride the wave a little bit and push it forward on what we were doing well and what we could do better. So that's one thing. You'll find new art lessons up there, artwork made by the kids that we've been doing for the last 3 months. But also we're launching this new platform with our partners. So we got our fingers crossed, and we're going to go for it. So that's the idea.
That's great news, Stephen. Making Art Possible. And the launch is today. Cool.
Launch is today.
Kristen?
Yeah. So I like to think that we've always kept a pretty tight pulse on what programs are needed or wanted in our community. And I think since COVID hit, you have to really rethink well, what we've been doing is like face-to-face education for youth, right? Like we do 6-week programs for youth where they're like with us, they're growing food, they're cooking food, they're interacting. If we're moving to virtual and we're making sure that our staff is safe and that all of our participants are safe, what parts of those need to be saved? What parts of that programming won't serve or won't work over a virtual platform? And then how can we take a virtual platform and still infuse the heart and soul into it? Because that's really difficult, right? That's one of the most important things I think that we need to be continuing to do with our communities, and right now it's one of the most difficult. Just as an example, for a couple of our programs with our teachers and then also with some of our youth, we put together like Blue Apron kind of boxes almost, and that got delivered to their houses, and then we do Zoom cooking classes, for example. For their youth, it goes a little bit further. Like not only is it just like instruction online, it's really integrating their entire family. Like lessons are really requiring them to go and talk to their grandparents or their parents about recipes or tradition, right? So there's ways of pulling in all of those pieces still. One of the things that was really obvious to us that obviously would be continued, right, is growing food. That's a huge need in general. And then we're in a position where a lot of our small farmers don't have the capacity to like bump up growing. I think one of the reasons we've been pretty well suited to adjusting to a lot of uncertainty and being okay operating in uncertainty is that farming is inherently uncertain, and it's just, you just never know what's going to happen. And so I think if you get used to operating and being comfortable in uncertainty, then you're able to be a little more honest about what, well, this isn't going to work this year. We need to switch, and maybe we can sell over here instead since the schools canceled all their orders. Or maybe the schools will want to do it in a different way, which they did, right? And then we're able to act as like this central point through which small farmers can sell to schools still. So I think sometimes it's difficult, right, to be really honest about what is necessary and what is not. We did have a moment where and we're still, doing this a little bit where things are starting to the food system was collapsing to some extent, right? Like things were not okay. There's like inherent vulnerabilities in it that still exist. It's still very fragile. We just like to think that it's not. But one of our things is we need to be growing more food. We have 22 staff people. We have a 14-acre farm. We need to be growing more food. How do we increase production while still making sure we're doing it in a way that is like increasing community knowledge, increasing the quality of the land and the environment, increasing community wealth and ownership, providing opportunity for people to create, economic opportunity for their families. So yeah, really just being honest about that, and like, well, maybe that means that every staff member is like spending 4 hours a week at the farm to help with weeding, because that is always a job, right? So being really honest, I think, about a lot of these things can be difficult. But I think once you get comfortable with uncertainty, it comes a little bit easier.
Thank you so much. Just a recap, Kathy, you had talked about data collection and analysis, and that when you make these decisions about what do you keep, what do you grow, what do you shrink, what do you retain, what do you transfer to another organization, those decisions should involve data collection and analysis, and not just be made based on very limited information from whatever accountability systems, program accountability systems you have, but rather a robust system. And I think lots of nonprofits have difficulty, capturing, enough information of high quality to have decisions be data driven. I mean, it's just the nature of where we are for lots of us. And nice to hear Stephen say that you went back to something that you're really good at, which is curriculum development. You know that the organization does very well with that. You've got a long history of providing good service in curriculum development, and so you essentially went back to that and made that program more robust, and changed it to accommodate the conditions associated with the way school services are now delivered or will be delivered in the fall. And then I really appreciated Kristen talking about comfort with uncertainty, you know, and certainly in agriculture, that is the way it is. And especially here where you have very limited rainfall and access to water. So it's just the very nature of agriculture is one of uncertainty, and it's accommodating that uncertainty and raising your comfort level with it. And those are attributes that can help you and your organization deal with change, imposed change from the outside. And that's a cultural attribute, you know, the fact that there's a degree of comfort with uncertainty that may not exist across the board in other industries. That's good. Now, Jana, we did have a question, right?
Yes, we actually have questions. One came through privately to me, so I'm going to ask that one first. The first one, it's not addressed to anyone specifically. Please expand on the focus on trust versus finance as drivers.
Okay, anyone?
Let anyone jump in.
I can say a little bit. If I think for me, when I think of trust versus finance, I don't know that it's one or the other. It makes me think about our organization, and last year, we've been going through change for several years. We decided we need a model to guide us through our transformational change. We dipped into Harvard Business Review. We found a model that talked about balancing fiscal and cultural. So that's what I was talking about earlier, meaning we do outpatient mental health. If we solely focus, and training and advocacy and a lot of other stuff, but if I focus on our direct service, so a therapist working with a family, if we say from a fiscal lens, you therapists need to see 8 clients every day back to back and have a certain show rate so that we can bill so that the organization is fiscally solvent. That's solely looking at it from a fiscal lens. If we look at it from a cultural lens, maybe, or maybe from a trust lens, and we say, we trust you to see clients. We're not going to monitor you, do good work. We'll see you in a month at our all staff meeting. That might be not taking into consideration fiscal at all. So how do we find a middle ground between those two lenses that is true to our mission, our vision, and our values, and help us remain fiscally solvent and reach our vision? That's what comes to my mind.
Thank you, Kathy. I'll just add, I'm sorry. Stephen, you want to add something?
I think it boils down to accountability. You know, if you've been installed with your staff as well as your participants in the program, and everybody has that sense of accountability. This is my part of the puzzle. And I tell my staff this, and I tell my kids this, you know, this isn't my painting, this is your painting. So once I give you the tools, and once we've talked about it, and once we understand each other, and it's been outlined, it's up to you. And I see that from a board member all the way up our organization. It starts with, you know, the kids that participate, they're held accountable for what they're doing. The parents are held accountable. Staff members are held accountable. Administration and beyond, the community is held accountable to help others and be accountable for what they can give and what they're responsible for. So I think when that's kind of communicated and everybody understands what their part is, the discussions become more fluid and people can actually contribute or said, I did the best I could there. And then you don't get into not only like, oh, was that my part? Was I supposed to do that? But also the ownership of, I did that and I was a part of that. And we've kind of instilled that, but I think it's something that you always have to bring up in your organization and to anybody that's participating in the community on what you do. Just say, I really need you to do this. Can you help me with that? And the response should be, okay, I can do that. Let's do it together. And I think those conversations have to happen with everybody from the participant all the way up to community leaders. And so I try to do that as much as I can.
Thank you. The only thing I was going to add was that I don't think they have to be mutually exclusive. I mean, it's not a trust versus an economic distress driver. I mean, you can respond to economic stressful conditions and also work with organizations and individuals with whom you have trust and build upon that trusted relationship. So they're not necessarily mutually exclusive. It's not, you know, you have trust, you go to your bank, and as Bill mentioned earlier, you have a good relationship with a bank. You got to have a good relationship with a bank versus going to a loan shark. You know, I mean, it's not that. It has more to do with the kind of the volitional part of that, you know, the economic stressors in and of themselves can make those changes occur at maybe a more rapid pace than would otherwise occur organically or naturally if we were in more normal times.
Bruce,
And then, I'm sorry, Bill.
quick comment on this. Our experience has been that it's fear that often becomes the impediment, and that even when something would make rational financial sense, it's the fear of the unknown, fear of loss of control, the fears that block folk from being willing to take a step forward. Rationality is based on an ability to see the ratios, to see the percentages, to see the odds. And fear distorts that and makes it very difficult to move forward.
Thank you. Jana, there was a question?
Yes, there's one question about mentorship. In what ways can an organization develop new leadership within their existing staff to help prepare for a future crisis?
I can jump on that one. That is something that we focus pretty heavily on in our organization. Whenever we say shared leadership, it's shared leadership at the top, right? But it's infused throughout the organization. I know I keep saying, I'm going to say this one more time. It's going to take a lot of time to do true and meaningful mentorship in an organization. A lot of our younger staff, we are really committed to developing and cultivating capacity in our communities that we work in. We think that's what needs to happen, and we think that's how long-term we'll be able to create healthier communities, right? Like that's what it's going to take. And so a lot of like young people who go through our programs or who come on as apprentices and then come on as staff members don't have, you know, like background or experience in a professional setting or all of these other things. But they have all these other attributes and they have the fire, right? They have like so much to give. And the amount of half of leadership is being, I wouldn't say a therapist, right? But you have to take care of your people. And that takes a lot of time. It takes a lot of effort. And it's one of the reasons I think that our shared leadership at the top is so effective. My fellow co-executive director, Christina, who's also a co-founder, is naturally and has honed this skill that, you know, people pay thousands of dollars for consultants to come in and tell you about, that it's the relationship, stupid, right? Like really doing that. She just has this really innate ability and has honed the skill of being able to focus on, listen to, and carry the weight of people. And that's what you have to do in your organization. Because when you do that and you take the time to put in that front end work and listen to people and really support them and to mentor them through all of these things, it pays dividends, right? Like you end up with staff who are engaged, who are completely bought in, who have fire, and who have, you know, take on like the cultural responsibility of carrying out whatever their job is, right? Or like creating their job into something that's even more than you could have imagined as an executive director. Like all of a sudden they're doing amazing things. So it helps to have, one of the things of cultivating that helps too, like because we've cultivated shared leadership, we have the capacity to our organization to invest the time. And we also put aside dollars, right, for professional development as well. But the time to do that, if I was by myself, I wouldn't be able to do like all of the external facing work, like this webinar or communications, working with funders and grant writing, and also fully support my staff like they need to be supported. So I think I can't overemphasize how important and how worthwhile mentorship is and how incredibly frustrating it can be. I think sometimes it can be pretty frustrating and pretty difficult, right? But yeah, it's definitely worth it. So.
Thank you. That was it, Jana, right? Okay, thank you. Our final question for the panel today is, if your organization faced the imminent loss of sustainable funding and were thereby required to merge into another like-purposed organization, what criteria would determine whether that new organization is a good fit, such as compatible mission, solvency, and fulfillment of program goals? Kathy.
I think it's a lot of what we've been talking about over the whole morning. I think that it's what kind of current relationship do we already have? What do we know about the other organization? So this is assuming we're going to get kind of bought out, right? Like taken over by somebody else. Then I would say, what do we know about them? What are their values? Their own fiscal solvency? Are we giving up everything about what we do? And there's a risk of the person who we got subsumed into for them folding. So, what's the fiscal solvency of them? I think a commitment to the mission, meaning like for us, it's about, we believe in providing high quality care regardless of your ability to pay. So that's a core piece of our fabric. So we would not want to be taken over by somebody who disagreed with that core concept. And then I think their organizational culture plays a role. I think that's something to investigate. I don't know exactly what that conversation and exploration would look like, but I think the culture would also play a role.
Thank you. Stephen.
Well, when I think about that, I'm very hopeful that Creative Kids would stay in a position of providing service and all those things. But I'm also hopeful that, at one point, Creative Kids goes to a lot of places and makes a lot of relationships, not only on a national scale, but also here locally. And I'm hoping to get absorbed, is what I'm saying. I hope school districts absorb us. I hope healthcare institutions absorb us. I hope that other organizations use our skill sets. That's really the idea, is to integrate and hopefully absorb a little bit into everybody's mission and help them with their solutions. And I think that was part of our mission at the beginning, was just to be helpful and do what we do best. So I'm actually welcoming the day that we're absorbed by a lot of organizations and say we should call Creative Kids. They're good at that. Let's bring them on board. Maybe we should work on a grant together. Maybe we should do something here locally for, the school districts. Let's bring all the superintendents together. Let's get the foundation to help each other. I mean, that's kind of where I see us as a community deciding in the pandemic that we should absorb each other's thoughts and skill sets to really achieve all of our goals, which is to make good people and to help people in our community. So I'm hoping that we absorb each other's missions and visions. And there is some sort, like Kathy's saying, of culture that we understand that this is for the greater good. And so I'm hopeful that they'll take what we're doing and use it as much as they can, because we would like that to happen more and more. So that's the idea.
Great, thank you. Kristen.
I was thinking about this question. I was thinking about, all right, if our organization was getting absorbed by another organization, and thinking of all of my staff and programs, the one thing, the criteria would be a values alignment. Because I think a lot of our work is so rooted in justice and equity, and the knowledge that inequity is the cause of a lot of the issues that we see in our communities. The spectrum from like health to food access to health outcomes, like all of these things have their roots in inequity. And then that then makes all of this work really intersectional, right? Like you can't focus just on food if you're not also talking about adequate access to affordable housing, or you're talking about access to healthcare, and you're not talking about equitable access to healthcare and health outcomes, right? So there are all of these things that come into play. So if you're really thinking about making a change in long-term sustainable transformation of communities into something healthy and vibrant and thriving, right? And all that those words mean, I think you really have to look at the root of like this justice and equity issue, and then figure out and be okay with knowing that all of this work is intersectional and it can't be done in a vacuum or without considering all of these other things. So I think when it comes down to it, I think the values piece is really one of the most important considerations.
Thank you, and thanks to all of our panel. We're just approaching noon. Thanks for the insightful remarks and for the thought that all of you put into your responses, because clearly not only did I benefit, but I'm confident many other people who participated this morning learned a lot and were able to capture your insights and help maybe use those insights in their own activity. Just a couple of buzzwords that came out of this. I mean, the importance of communication to staff, to your board, and out to the community. The importance of equity, because that's foundational for the nonprofit work. Authenticity, Stephen, I think, referenced that authenticity, the need for trust, and Kristen was talking about intersectionality, that it's all intersectional. I had a health director from the state of Washington tell me years and years ago that it's all about relationship, all else is derivative. And because she thought I was slow on the uptake, she repeated all else. All else is derivative, all else. And it truly is about relationship in ultimately organizations to organization to other organizations is really about people to people and the people who represent those organizations. So thanks again to all of you. Michael?
Yes, thank you. Thank you, Bruce. Thank you to the Realize panel and Bill Schlesinger for being here today. The letters of intent are due July 10th, and I'm hopeful, even if you choose not to submit a letter of intent for stage one, that these sessions were helpful to you. I started off this session with a short story about me on a farm, and storm came through, had to clean up, and preparedness. And now that we're kind of ending, I would like to share with you and use some words that Bill and others used. I really wanted that land for my family and my kids to enjoy, and I was afraid I wouldn't have it. Fear, and I had passion and love for that thing there. But eventually I did have to transform and sold it to my cousins, and this week one of my children are out there enjoying it. So there was a way to meet my mission and get that done. But I was really stymied and fearful that if I didn't hold on to it, if it wasn't the old way, but man, things are really nice out there now. So I think you can resist change, you can accept change, or you can lead change. And I'm hopeful that you will challenge yourself to think deeply with partners, including your board and clients, about an opportunity to lead change for your organizations and not simply just adapt to change that is happening. I offer my email, telephone call, as well as that of all the program staff. Claudia and Juanita on our staff are available to you if you have questions about submission of the letter of intent, kind of where to go, what to do there. So I encourage you to reach out and have a conversation if that's something you want. I appreciate you and your time. Thank you. Have a good day.